Paronychia. What in the world is that? I literally murdered this name when I thought I knew how to pronounce it. Actually, a wound care nurse enlightened me into this condition when I myself got it out hunting in the ditch. I got a cut from grass and it became infected. It's actually an infection of the tissue folds around your nail beds on either your fingernails or your toenails. So it can happen either way. It comes from staph, strep, or gram-negative mix. So it can be very hard to treat and to keep it away in the first place. There's over 200,000 cases a year in the US, so it is fairly common. It's again caused by injury or irritation, a cut, a scratch, a puncture, a cuticle, if you pull on a cuticle and have that come out, a hangnail, or continually having wet hands. If you're a dishwasher, if you're a car washer, if you're a detailer, or if you're even working in your home and you're continually getting your hands soaked and wet, you're going to be more prone to it. If you bite your nails or pick your nails, as I do, you're going to be more prone to it. And then people that have HIV or going through cancer treatment also are going to be more prone to it, basically because your immune system's down, where normally you wouldn't have this kind of thing. Because your immune system's down, you can get this infection fairly easily. The tissue becomes swollen and red and can be painful. If it gets really bad, you can see pus coming out at the edge of the tissue itself. You don't want to let it get to that point, and you also don't want to puncture it because it does look like it needs to be punctured. Well, if you puncture it, you can make the infection worse. You need to go see a provider before that, let them do it in a sterile situation, and then be treated with antibiotics. It can be acute, but it can also be chronic, especially if you continue to be in the same situation, keeping your hands wet, biting or picking your nails, pulling on your cuticles, or being on cancer treatment or HIV medications. Treatment with nail soaks for 15 minutes in warm water twice a day, and then thoroughly drying them out. That can help when you first see this coming on. As far as using Epsom salts in there, you can do that. You don't have to do that. But if it doesn't clear in 3 to 4 days, go to your provider and get an antibiotic. It's not going to go away on its own. It is an infection. Now, the antibiotics that you're looking at, basically you treat it starting out with Bactrim DS or sulfamethoxazole trimethoprim, or doxycycline, clindamycin, Augmentin, or Keflex or Ceflexin. You want to start with the mild gun first if you can, but as was my case, I started out with Bactrim and it did not cut it. It was pretty bad as far as that went, and I had to go to doxycycline, which did knock it out. As far as topical antibiotic like creams and ointments, you can use that, especially if you have a mild case, to keep it away, and that's absolutely fine. Your doctor may also provide or prescribe you or tell you to get an over-the-counter topical antifungal as well to help out. As far as prevention, don't pick or bite your nails or cut your nails too short. Also, if you get a pedicure or manicure, don't do it often. The more often that you have those, the more prone you are to having an injury, cut, or scrape, or having your nails cut too short. Wash your hands and nails frequently, especially if you work outside, farmer, rancher, in construction, that kind of thing. Really wash your nails, get behind the nail, get really clean. Use lotion on dry skin, especially the cuticles, to keep them so they're well hydrated so you don't cut, scratch easily. If left untreated, it can develop into a nail fungus situation where your nails will actually grow abnormally, different coloration of the nail, and potential loss of the nail. So don't let it get to that point. Try the over-the-counter antibiotics and the nail soaks first. If it doesn't clear up in 3 or 4 days, see your provider, get an antibiotic, and get it treated.